Okay, we'll go ahead and get started. It's 1 o'clock. Today is Thursday, July 30th. This is the QC COVID-19 press briefing. Thank you all for joining us. Today, along with Ed Rivers from the Scott County Health Department and Nita Ludwig with the Rock Island County Health Department. We do also have members of our QC COVID-19 Coalition. We have Dave Donovan, Director of Scott County Emergency Management Agency. We have Dave Herrell, who's President and CEO of Visit Quad Cities, as well as Paul Rumler, President and CEO of the Quad Cities Chamber. We're going to hear from each of the panelists that are on with us today. They'll have some prepared statements, and then we will go to the Q&A session as we usually do. So please type any questions that you have in the chat. We received a couple ahead of time that we'll also be using. And if there's anything else, please put it in there. We will go ahead and get started with Nita. Can you give us your numbers as well as any statements that you have?
Thank you. Good afternoon, everyone. We are reporting 49 new cases of COVID-19 today in Rock Island County, and this is one of our highest daily counts that we've reported thus far during the pandemic, and it is concerning. As Governor Pritzker was here Monday, stated that this is trending in the wrong direction, and we must get this number down or we will overwhelm our healthcare facilities and hospitals. Several new cases today, 21 of them, are associated with a long-term care facility in the county. These are one of our most vulnerable populations, and we are working with all of our long-term care facilities. We have provided them with personal protective equipment, testing supplies, and we are working in consultation with them on mitigation strategies as well. So I cannot emphasize enough, wear a mask. Even if you're not required to do so, you can still choose to wear a mask. Social distance, keep that 6-foot distance between yourself and others whenever possible, and stay home as much as you can, and especially if you're feeling ill. And if not for yourself, please do it for others in your life that you care about. So with the 49 new cases today, that brings our total in Rock Island County to 1,550 cases. And our death toll remains at 30. And currently there are 13 people hospitalized in Rock Island County. Thank you.
In Scott County today, the total number of cases is 1,527. Our deaths remain at 11. The COVID-19 pandemic has required us to work together as a community to prepare a robust response to the spread of the virus. That started with responding to the closures of restaurants, bars, and many public places. We then responded to the reopening process of public spaces and establishments, and as a community, we faced the start of the academic year and anticipate changes and the challenges this will bring. Through this all, our community response has been coordinated by participation of organizations from all sectors in our community in the Quad Cities. We are joined today by 3 representatives from organizations that are members of the coalition. We appreciate their support during this public health emergency and commend their dedication to supporting and protecting the Quad Cities during these trying times.
Thank you, Ed and Nita. First, we are going to hear from Dave Donovan with Scott County EMA. Please go ahead, Dave.
Thank you, Brooke. Good afternoon, everyone. Today you're going to hear of a new initiative or a campaign from a group called the Quad City COVID-19 Coalition. You've probably heard of this coalition before. I was asked today to open up with some background on what the coalition is, why we exist, and what we do. Beginning in mid-March of this year, when COVID began to impact our community, a diverse group of organizations recognized the need to have a coordinated response to COVID in our community. We found that this is not an event. This is not a virus that is solely the responsibility of public health, that we all have a stake in this and we all have a responsibility to work together. We have a strong history doing that here in the Quad Cities. So since then, this coalition's been meeting to discuss issues and share information regarding COVID-19 and the impacts of the virus to the Quad City region. We've also discussed how to adapt, respond to the changing landscape and the numerous challenges that have been presented to us by the virus. The Quad City COVID-19 Coalition is made up of representatives from business, tourism, public health, healthcare, emergency management, city and county government, first responder organizations, our federal legislators, social service and nonprofit organizations, philanthropic organizations, faith organizations, and local school districts, to name some of our members. Currently, the coalition meets every week, Wednesday mornings. In addition to response issues, we discuss messaging, information that the coalition needs to share with the community. These press briefings and the guest speakers are a part of that effort, as is the campaign that you'll hear more about today. Other topics that we discuss include COVID testing, personal protective equipment, homelessness and sheltering, and the availability of food and other basic needs for vulnerable individuals in our community. We talk about how COVID has changed and challenged the delivery of services for our organizations, as well as the availability of federal assistance and other economic support for the impacts of COVID. More recently, we've discussed how to respond to the recent dramatic increases of cases in our community. In a moment, you'll hear from two other members of the coalition, Dave and Paul, about what our ask is of the community to help us reduce the number of cases and adapt to living with COVID in our community. Above all else, the Quad City COVID-19 Coalition exists to ensure that we are responding to COVID-19 in a cohesive way and in an informed way. We are not simply working in our silos, we are working in the collective together. As the coalition website indicates, we are together Quad Cities. Thank you.
Thank you very much, Dave, for that introduction. We appreciate it. Next, we will hear from Dave Herrell with Visit Quad Cities. So please go ahead, Dave.
Thank you, Brooke. Good afternoon. Really appreciate your all's time today with us. I do want to recognize Ed and Nita and Dave for all the work that they're doing with the most extreme challenge I think we've ever faced, not only as a community, but certainly as a country. So thank you for everything that you're doing. And I do want to thank Paul for the partnership and the friendship and the close collaboration our teams share. And I think it's really important that the COVID Coalition has come together to really be that defining voice for how we're responding to COVID-19. So it's been a very robust team effort. It's been highly communicative, highly collaborative, and I think it's very important. So today I wanted to announce that the COVID Coalition is launching the Together QC campaign. We are really looking forward to making that we continue the message that needs to be put out there on a daily basis, on an hourly basis, that we need to do the right thing in our community. We need to make sure that our community is informed. We need to make sure that we're masking up. We need to make sure that we're social distancing, that we're practicing good hygiene. The things that our healthcare providers and our public health officials and experts have been telling us literally since we've embarked on this challenge. So even though we're 5 months into this, we need to continue to share that message because it's critically important. I think everybody has the same desired outcome. We all want to get back to the very best version of the Quad Cities. So we've got a very robust media and promotional campaign through the variety of platforms that we have available to us, not only from a Visit Quad Cities perspective, but really the COVID Coalition, including our friends at the Chamber. I want to thank our media partners. We've got 10 media partners who are working with us as a collective to make sure that the community is informed, that they are hearing the messaging, that they've got the tools and the tool belt to do the things to share with their constituency. Visit Quad Cities has a welcome promise. Certainly we want Quad citizens to follow all the guidelines and the protocols, but also visitors. I think our visitor economy and tourism is absolutely critical to the QC, but we need to make sure that people are doing it in a responsible and a safe way if they're consuming the Quad Cities. So it's important that we put this package of communication that's out there. So from our perspective, we're looking forward to sharing this information. I think if you go to togetherqc.com or the Chamber's website, visit Quad Cities website, any one of our media partners, you're going to learn all about Together QC. And I urge you as Quad citizens to let's be good to one another. Let's make sure that we're being patient. Let's make sure that we're wearing our masks. Let's make sure that when we go into a respective business that we're doing the right thing, because I think everyone wants the best for each other. And certainly we want to do everything that we can to preserve our future because it's important. So Visit Quad Cities is proud to play a very small role in the delivery of this campaign. And we're honored to be part of the COVID Coalition, and whatever we can do to share information with the public, we'll do it. So thank you so much for the opportunity, and I'll turn it back over to Brooke. Thank you.
Thank you very much, Dave. Next, we will go to Paul Rumler with Quad Cities Chamber. Please go ahead, Paul.
Brooke, the beauty of batting cleanup is that I get to say I agree with everything that all the preceding speakers said, and I don't take that lightly. The Quad Cities is a great community, and the COVID Coalition has been doing great work over the last 5 months. People that you've heard from so far today have really invested a good deal of their lives to respond to this pandemic and make sure that the Quad Cities community is pointed in the right direction and that we have the resources and the data to do our jobs and keep people safe and healthy. From the beginning, the Quad Cities business community was very instrumental and supportive of handling the pandemic in a manner that helped flatten the curve. And I think that the data points that was happening. The Quad Cities Chamber had been advocating for a safe and responsible reopening when the time was right. That was happening. The business community has been, at an overwhelming majority of them have been responsible in their reopening of making sure that they were applying the appropriate safety protocols and social distancing measures and guidelines in their businesses. Today's Mask Up Together Quad Cities campaign is extremely important to make sure that our economy remains open. The last thing that we want to see is the Quad Cities economy go backwards. As we look at the data, it is very concerning that if we don't do something drastically to stop the direction, we could be facing some reversion in our policies. And that's not something that we want to see happen in the Quad Cities. The last 5 months have already taken a tremendous economic toll on our community, both in terms of the businesses themselves, but also area residents. We've seen unemployment numbers go in a direction that we're not happy with. And we'd like to get back to, as Dave said, as much of a pre-pandemic normal as possible. So I'm masking up on behalf of my family, friends, but I think that masking up is also something that we can do for our Quad Cities region and our economy. So we're imploring all residents, all businesses to make sure that they're thinking about these protocols that have been in place over the last 5 months and think about what they can do differently going forward to make sure that we keep the Quad Cities open and a safe place.
Thank you very much to Paul, Dave, and Dave for those pieces of information. We greatly appreciate you sharing this. We do have some questions here, so we are going to start. I'll start with a couple that we received earlier, and then we'll get to the ones that have been typed in there as well. So the first questions, Nita, can we bring you back for a couple of these? The first one was related to the increased number of cases today. You did share that it was an outbreak in a long-term care facility. Is there any additional information you could share on that? I think they're hoping for a name, but you could give us information on what you're able to share.
Sure. So the Illinois Department of Public Health has made the outbreak information on long-term care available. So I can share with you that 21 cases today were from St. Anthony's Care Center in Rock Island. But in addition to the 21 cases with the outbreak, we also have 28 new cases unrelated to that today too. So that is still an upward trend that we'd like to see go back down again.
Great. And then there's another follow-up. Would you please give us an update on the number of Tyson-related cases and deaths, if there's anything different? And I think it said last time you reported it was 163 cases and 2 deaths.
Sure. And that number I just checked this morning, and it remains the same, 163 total, and that's from the beginning of the pandemic until now. So their numbers have remained unchanged for at least the last 3 weeks, and maybe a little bit more. So Tyson has done a really good job of mitigation there at the plant, and they continue to do so. I'm sorry, did I miss part of that question?
No, I think you got that.
Okay.
The last follow-up on the ones we received earlier, is Rock Island County now on the Illinois warning list? And if so, what does that mean?
So, okay, what we don't know yet is if we will turn orange in our county alert metrics. That's on the Illinois Department of Public Health website. And those statistics lag a couple weeks behind. Right now, they're still showing through July 18th. And through that date, we were not in the orange, if you will, or the warning. We still had a high number of cases. That one metric was putting us into a warning, but not overall. I believe that the governor said if you have 2 or more of those metrics that are not within the target ranges, that your county would turn orange on the map. And that's really just an indicator that you need to look into what people are doing. Things are kind of going haywire, and what can you do to address it? It's also to look at was there a big gathering or a big event, or what is the reason behind the spike?
Thank you. Paul, we did receive a question for you regarding employers. Have you had talks with businesses and employers about ways they are working with their workforce and adjusting to their children's remote learning needs in the fall? And anything that's coming out of there from other businesses that some can learn from?
Thanks, Brooke. Great question. Childcare is one of the top issues that businesses are trying to address right now. Really, we're in a time of great uncertainty. I think that on a daily basis, new information comes out regarding the return to learn plans, both in Illinois and Iowa, and we're going district by district right now. So employers who have a workforce that spans the entire Quad Cities, both states, it's a period of great uncertainty. And so most businesses right now are waiting for the final verdict to come from those school districts and from the state, so that way they can put a plan together, because the plans that they have right now are in flux. And so when we've been talking with our businesses, they say that they're preparing as best they can. Some of the solutions that they're talking to their employees about are flexible work environments, working remotely, but childcare availability continues to be a big issue, because not all workplaces are able to be flexible. Some work needs to be done at a certain period of time, and some of that work cannot be done remotely or at home. And so that's going to be one of the biggest things that's needed. And so we've been in touch with many of the child care providers, our school systems, United Way and others, and trying to understand how we can provide updates to them about the availability. But I think continued financial assistance for those providers is part of the solution. Other businesses that are starting to contemplate as to whether or not they can provide child care services on site. Not many of them are in a position to do that. So we're really talking about off-site services.
Thank you, Paul. There's a question here for Dave Herrell. Why wasn't there a masking campaign sooner? And mentioning that Dr. Katz has been calling for people to wear masks indoors for quite some time. Perhaps you can kind of enlighten them to some of our discussions about the recent surge in cases.
I would, thank you, Brooke. I appreciate the question. I will tell you from Visit Quad Cities perspective, we have been promoting wearing masks for a while. So that is something that we have been, pushing out through our platforms and our channels, and the COVID Coalition has been doing the same thing. So I think those messages have been out. I think everyone has been clearly articulating that for a while. But we also felt like it was maybe time to make an adjustment and put out another campaign. So although we're talking today about a campaign that we're now launching, the messaging of practicing social distancing, masking up, good hygiene, these things have been out there for months. But we also felt that it was the right time since we were seeing some numbers go in a direction that we weren't comfortable with. We need to continue to press on the gas. So that's really why the sort of launch or relaunch, if you will, of some additive messaging to put it in the marketplace. We felt that was important, and then also to get a consortium of media partners to continue to push out PSAs collectively. So this certainly is not starting today. This has been going on for months.
Dave, Donovan, would you like to add anything to that since you've been facilitating a lot of these conversations with our group?
Make sure I unmute. Yeah, as Dave mentioned, we've been pushing this messaging out, for months already. I think what has changed maybe with this is the want to reinvent that messaging, reinforce that messaging, and deliver it in other ways to the community. I think the message has been going out. I think it maybe hasn't been heard or hasn't been heard as well as what we had hoped. And, with the cases going in the wrong direction, I think we just felt it was time for a big push for this. We've got to get the community to understand what we're asking of them. And that is, we're asking you to modify your behavior a little bit, wear a mask, take all of our recommendations more seriously, because in order for us to have good outcomes, that's what we need from the community right now. And yeah, we're launching some videos today, but the words in the videos, the message to the community hasn't changed. It's just being packaged up a little bit differently. And we're making an announcement of a new campaign, but we're asking the same thing of the community, but we're just imploring the community to please hear the messaging, take it to heart, wear a mask when you go out into the community, social distance, practice the personal hygiene, and we'll get through this together.
Great, thank you for both of you for that answer. We do have one additional question here, it looks like, and this will be for Ed. For the Scott County health officials, what do you think of the return to learn guidelines released this morning by the governor as far as the benchmarks for the COVID-19 numbers and where they should be before school districts can switch between the various learning models?
That's a question that would be best addressed by Dr. Louis Katz, our medical director. I don't see him on the call today, but once we have the text of the declaration and the specific guidelines put forward, we can ask him to provide you an opinion at a later date.
Thank you. It doesn't appear that we have any additional questions for today. So again, thank you everyone for joining us. Thank you to Dave, and Paul for joining Nita and Ed today. We're grateful for the support of the coalition and all of you participating, as well for your support as we're doing this PSA as well as this larger campaign. So we are going to go ahead and conclude for today. I will type into the chat that everything that they have talked about today with the campaign is available on the Together QC website, www.togetherqc.com. There's additional downloads there, and we will have different versions of the video PSA that are available for download. So we encourage you to share that in any messaging that you do based on this information that we've shared today. And again, we appreciate your support and those of our media partners who've been willing to join us in this campaign and get the message out. So thank you everyone for participating, and we will talk with you again soon.
Thank you, everyone.
Thank you.
Thanks, Brooke. Thanks, everybody.
Brooke.